Good afternoon, and thanks everybody for being here today. It is hard to believe that we're almost a quarter of the way through 2021. Each day, we continue to move forward and make progress on all fronts. We are happy to report that Missouri is now number 10 in the United States for second dose completions at a rate of 93%, well above the national rate of 88%. Additionally, 25%, 1 in every 4 Missourians age 18 and up, have initiated vaccination, and approximately half of Missouri's 65 and up have initiated vaccination. This is great news for Missouri, and we will continue working hard to give every Missourian who wants a vaccine the chance to get one. As you know, Phase 1B, Tier 3, was activated on Monday, which includes K-12 education, child care, and many other critical infrastructure sectors. There have already been several events across the state to vaccinate teachers, which is great news. Tomorrow morning, we'll have the chance to visit vaccine events for educators here in Jefferson City and Kansas City. We are thankful for our partners across the state for their efforts to prepare for Tier 3. When we activated Tier 3, we said we would be able to activate Phase 2 within 45 days of March the 15th. However, with progress we're currently seeing and vaccine supply expected to increase significantly in the coming weeks, we are well ahead of schedule. The federal government has informed us that COVID-19 vaccine allotments to Missouri are projected to increase significantly by the first week of April. Supply projections are subject to change, but it is critical that we start preparing for this potential influx and ensure there is a consistent number of people who are eligible and interested in receiving a vaccine. So with that said, we will be opening up Phase 2 on Monday, March the 29th, and Phase 3 on Friday, April the 9th. Phase 2 will activate approximately 880,000 Missourians that are essential to economic recovery, including those employed in construction, critical manufacturing, higher education, and the remaining food and agriculture sectors. This also includes the homeless and disproportionately affected populations, with a continuing emphasis on our minority communities. Phase 3 will be open to all Missouri adults, extending vaccine eligibility to an estimated 1.1 million Missourians. Combined, Phases 2 and 3 will make approximately 2 million more Missourians eligible to be vaccinated. All currently eligible Missourians in Phase 1A and Phase 1B, Tiers 1, 2, and 3 will continue to be eligible. With the phase activated, approximately 4.5 million Missourians will be eligible. Of these 4.5 million, we estimate that approximately 60% will choose to get a vaccine. And I think that is important to note, that of that 4.5 million, as we see currently, about 60% will request that vaccine. Tomorrow, we are looking forward to the mega vaccine event at Arrowhead Stadium in Kansas City. Between Friday and Saturday, we expect to vaccinate approximately 6,000 to 7,000 Missourians with the Johnson & Johnson vaccine. Setup is underway this afternoon, and we are excited to kick things off tomorrow morning. This week, we also announced a mega vaccine event in St. Louis Community College at Forest Park in partnership with the St. Louis City Health Department, Mayor Crusen's office, local leaders, and numerous volunteers. Like the Arrowhead event, this will be a 2-day clinic starting next Thursday, March the 25th. The Missouri National Guard will be on the ground Friday and Saturday from 8 a.m. to 6 p.m. to vaccinate a total of approximately 6,000 eligible Missourians. We expect to be able to administer up to 3,000 Johnson & Johnson vaccines each day. There will also be another mega vaccine event next week at the Family Arena in St. Charles. This event will operate from 9 a.m. to 7 p.m. on Thursday and Friday, with more than 3,500 initial doses of the Pfizer vaccine expected to be administered each day. In addition to these mega events, other locations have been identified in the St. Louis area to administer another 5,000 doses over the same period. Through these clinics and a mega events alone, we expect to vaccinate approximately 18,000 Missourians in Region C in a 3-day period. And since late January, we have been communicating with our federal partners at FEMA about setting up additional vaccination sites using federal allocations in our urban areas. This will continue to alleviate the current backlog and local providers are facing due to the high demand for vaccines in other urban areas. And with supply increasing, we are hopeful that these backlogs will be cleared very soon. I do want to add with the work we've been doing with FEMA on the federal level has been ongoing, trying to make sure that we could get all the details worked out. Where FEMA would come in with their supplies, their vaccinators, and be able to help us to be able to administer more vaccines. This conversation had taken place about over 30 days ago with the White House and the President's administration. So we're glad to be able to put that together. Glad that they're going to be willing to come into the state and help with those resources. And again, that we're working on those plans as we move forward. But it looks like at this point, both of those events will probably be in the St. Louis and Kansas City areas. Above all, I want to remind everybody here, all of this was part of the plan that we started in October. Missouri has had a vaccine plan since then, and this plan has not changed. We have been very disciplined, and we are making progress and moving forward as planned. Overall, Missouri's position is continuously improving on the COVID-19 front. Our economy is bouncing back strong. Missouri is still leading the nation at second lowest of average daily cases, and each day more and more Missourians are receiving a vaccine. With over 1.2 million Missourians that have initiated vaccination, large increases in supply, and the activations of Phase 2 and 3, we are confident that we are winning the battle against COVID-19. Thank you, and God bless. Kelly, Dr. Williams? Dr. Williams?
Hey, everybody. Obviously, an incredibly exciting day, and I like to start out with thank yous, and just want to thank the governor for executing the plan that we put together in October, and just incredibly excited as a clinician for all those providers who can now have a very known pattern about how we'll be vaccinating people and start putting their plans into place. That's very exciting for us. I think the other thing is that I just want to acknowledge yesterday we were all out at SEOC. Can't thank Aaron Willard, the governor's chief of staff, for coming out. The SEOC, State Emergency Operations Center, has been activated a year now. Our state is 200 years old. That's the longest it's ever been activated, and I hope that record, nobody ever tries to break that, because a year is a long time. But I can't just really appreciate Aaron coming out and some very gracious words of thank you on behalf of the governor, and to Jim Remillard, who heads that, and Sandy Karsten and General Compton. I know on behalf of all of us, we greatly appreciated those sentiments. And so, I always finish up my thank yous. As the governor said, we remain number 2 in the country for the fewest cases over the last 7 days. Incredibly appreciative of that. I'll be in Kansas City on Saturday. The governor will be there yet tomorrow. And just can't thank the chiefs enough. Again, they've been great community partners, and just speaks to the character, I think, of their organization, that they've been so helpful with us, and many community partners as well we've been working with there to make this happen. So just want to put in a special thank you to them. Kelly? Happy? Hey, Emily.
Hi, Dr. Williams. Just a quick question, and if you don't have the answer to it, we'll focus on this later down the road. A lot of people have already received the vaccine. Have you heard anything from the White House about what the plan is about? Is it going to be like a flu shot? Are we going to be talking about getting another shot in the fall? What have you heard from our federal health officials?
Yeah, I think that it's all under investigation. Clearly, the NIH has been given money to look at that. So at this moment in time, I would tell you the encouraging news. The encouraging news is the longer we work with the vaccine, the more time we have to see that it is long-acting. As you may remember, the CDC and the Moderna and Pfizer rule said 30 days we're kind of speaking for, but with the J&J for all the vaccines now, they've really said that we think it's effective for at least 6 months, if not longer. And all the early evidence shows that it is long-acting. Now, to your point, come fall, it's a different season. Things happen. We see that with the flu. You get a different flu shot. So I think people are actively looking at that. But at this moment in time, I think people are highly encouraged by the 3 vaccines on the market about their long-acting ability. So I really appreciate you asking the question, because I've heard a little bit of this sentiment that people have gotten in their heads that it's short-acting, and we clearly don't think that's true. We think it is long-acting.
Dr. Williams, going off of that, we touched on it last week about the CDC guidance for fully vaccinated people. I know there's still a lot of questions about the variants and if the vaccine protects you against the variants. Are we at a point, even though there's still these questions in the air, that people are safe to gather if they are fully vaccinated?
Well, again, I think if you look at the CDC guidance, it really speaks to private settings more than public. It's really about grandparents going to a house. And so I think in a conversation with Director Walensky last week, that guidance is pretty narrow. It's really kind of more for private settings as opposed to big settings. But at the same time, I think that they were pretty clear that even though we're incredibly appreciative that they've relaxed those some, they still want people to do those things, such as wash their hands, social distance, and mask when they can. Does that answer the question?
Yeah, I was just wondering, as far as the different variants go,
Yeah.
I know we just don't know a lot about that yet. There's still
Yeah.
a lot up in the air.
Well, and again, thank you for helping me follow up on your question. So far, the 3 vaccines that are available in the United States are very efficacious against all the known variants in the United States. So we're thankful for that. We do think the UK variant is widespread. Dr. Walensky in the same conversation said she thinks it'll be the dominant variant in the United States in 2 more weeks. But the vaccines work against it. So that's even more reason to get vaccinated, to continue to do those things that we think prevent people from getting infected. And I think if we do that, we're going to find ourselves in a much, much better place by the beginning of June.
Hi, Dr. Williams.
Hey, how are you?
Good. How are you doing?
Good.
Good. So this question is actually from one of our reporters, Elizabeth Hoffman. She's been looking at the relationship between vaccines and insurance companies. So while the vaccine itself is free for people, those who administer the shot, those who administer shots are able to charge insurance companies for issuing the shot. So Liz was wondering, and she has found that not all insurance companies are covering the administration of the vaccine. So what do you say to insured Missourians who get a bill for the COVID-19 shot?
Well, first thing I'd say is the federal government's been really clear. There should be no American who doesn't get a vaccine because of the ability to pay. That every American, since they provided it free, the expectation is that should never be a barrier to your getting the vaccine. Their health departments, FQHCs, our mass vaccination clinics, there are multiple platforms to get a vaccine. Now, to your specific question. I'm not sure I know all the legalities of it, but it's a preventative code. I practiced for 30 years, and preventative codes are usually covered by insurance companies because they don't want. It's a lot cheaper to pay for a $20 vaccine visit than a 10-day hospitalization for COVID. So I guess my professional expectation as a clinician is, since it's a preventative code, we would certainly hope they would pay for that.
What should they do if they do get a bill?
I think that, again, you certainly follow up with us. We'd be happy to know that. And I don't know if that's the most efficient way to do it, but we'd certainly like to know that. Because, again, the federal government, which has put a tremendous amount of money into this, has been very, very clear about their guidance. So, thank you.
As the tiers open up and more people are eligible to get the vaccine, will state health officials be making any efforts to combat vaccine hesitancy and people who are unsure if they want the shot?
Absolutely. We've talked with the governor about that, and part of opening up these tiers is we anticipate that as we get further out, that we'll encounter more vaccine hesitancy. It just kind of makes sense. What I've said repeatedly on that is, as I go around the state and talk to people about it, and I was, at Swope last Saturday and have been other places in Kansas City, to me it always comes down to a matter of trust. That whatever community you're in, and you see the different surveys of different communities, and again, from practicing 30 years, I would tell you that when it comes to those issues, no matter what argument you're giving, safety, efficacy, how it was developed, so much of it is, do you trust the one giving you that message? And so that's why we think it's just so important to have those relationships with your private provider, your clinician, the person who takes care of you, your clergy, the people who you worship with, leaders, state leaders, local leaders. So that's something we're going to be very much focused on, is those relationships. We're well aware that people have hesitancy because they're worried about side effects and they're worried about risk. And we can address that through education. But for me, what it often comes down to is that we have to find those people in each individual community that people trust. And there's nothing wrong with that being different people in different communities. That's fine. I practiced for 30 years and I get that. People are different and they're going to listen to different people. And it's our job to figure out how to work with them to do that.
Okay,
thank you.
Governor Parson?
All right. Sorry, I was in a conference there on that.
Governor, you mentioned working with the federal government and FEMA. I was wondering if Mayor Lucas from Kansas City's letter to FEMA asking them to step in for help played any role in that or added to the urgency?
Not that I'm aware of. I mean, we didn't talk to Mayor Lucas about the letter or anything. I mean, we, long before that letter was taking place, we were talking to FEMA. Matter of fact, they had worked with other states for quite some time. We were just trying to work out what that would look like when the federal government come in. Originally, one of the things we got when they wanted to come in the state, they wanted us to supply the vaccine and the vaccinators. Well, that really wasn't much of a help to us because that wasn't the problem. The problem was getting more vaccine. We had the National Guard to help us on the labor side of it. So really, this has been an ongoing conversation we've had with them for some time.
Governor, going off the hesitancy that we are expecting, kind of Dr. Fauci called upon President Trump to address this for some of his supporters. Do you think that's an issue that we're going to be seeing here in Missouri, as we have a lot of supporters for Trump?
Well, I don't know what political remedy it has to whether you take a vaccine or not. I've never heard that. I know what you're talking about there on the argument, but people in this state are smart enough to know what the situation is. And like I said, it's been pretty consistent. When I said 60%, that's about where we are in this state. And people here are going to take a vaccine or not. I don't know if they're going to take it because I tell them to or not tell them to. I think I'm going to encourage people to take the vaccine, and we'll be doing that from the state level. But people's going to make up their own mind regardless of. I don't know about all that the stuff, the political side of that on the president.
Hi, Governor. Question about the Johnson & Johnson vaccine. A few weeks ago, I don't remember if it was you or Dr. Williams, one of you said that once the Johnson & Johnson vaccine came out, the supply to the state was going to drop until the first week in April. And now we're having all these mega vaccine events, obviously this weekend, next weekend, and that's supposed to be the Johnson & Johnson vaccine. So are we getting more Johnson & Johnson vaccine than what we were originally told? Because a few weeks ago we were saying it was going to be the first week of April is when that supply picked up again.
Right. We did get that large supply of Johnson & Johnson, and then there has been a delay since then, or smaller amounts, very small amounts. But we know that's going to pick up. But we also know that Pfizer and the Moderna has also picked up. As you move forward, I think you're going to see vaccine, all three, you'll see it increase in some way. But I don't think we really know what those numbers are till we make them orders every week to find out. But we definitely believe that there's going to be a lot more vaccine coming to the state. I think you'll see somewhere by the end of this month, I think you'll for sure see 250 plus, and I'd say by the end of April you could see 500,000 to 500,000. I mean, there's going to be a lot coming in.
But all the mega vaccination events, they're using Johnson & Johnson, correct?
That's correct. That's correct. The ones of the Guard are. And here's the other thing I'd like to say about that. You know, when we're going to go back to the plan that we talked about originally. We knew when we go to, let's say, for instance, rural Missouri, and I know there's been a lot of hype made against rural and urban, but the reality is when you go to rural Missouri in the beginning, you're going to vaccinate a larger percentage of that when you have a mass vaccine or you have other sources there. So you don't have to go back. So then we can take those resources and start shipping those to the urban areas simply because we know it's going to be a longer time to vaccinate people in those urban areas, especially the big cities, St. Louis, Kansas City. So if we can keep we can keep changing that supply channel a little bit to those bigger areas because we don't necessarily have to go back to areas across rural Missouri 2 or 3 times like we will have to stay in St. Louis, Kansas City.
As a result of those mass vaccination events that are starting in urban areas, will we see less vaccines coming to rural areas in the sort of volume that we have seen in the last month?
Well, it'll be on supply and demand somewhat there, but we're going to look at a lot more other avenues in rural Missouri. For example, we don't need to do mega events so much in Missouri after we've been there and done one. We can start using more of the health clinics, more of the pharmacies, more of the local levels to administer on that area. To where when we do a mass vaccine, everybody's kind of adopted that name of mass vaccines. Mass vaccines is what we're actually doing. We're calling it mega tomorrow, but that was the whole intention of those to be able to do, to be a major amount of people we can vaccinate, 6,000 to 7,000 to 8,000 people to 10,000. Those were what we would consider mass vaccines originally, but we know just because of supply, we had to cut that down to about 2,000 a day to be able to do that. So, this is the things that I guess I want to assure you that was planned from day one. We knew as that vaccine was going to be very limited. Okay, where do you go in all those regions when you first start out? And then as the vaccine expands, then you can kind of continue to move that around to where you need it more. And to be able to know, again, St. Louis, Kansas City is going to take much longer than a county of 30,000 people to vaccinate.
Hey, Governor. Just to kind of follow up on more rural vaccines, from the numbers that you've seen, for people who live in rural Missouri, have they exceeded your expectations by the percentage of those people who are getting vaccines, or are they fewer than maybe you expected?
No, I think it's going just about the way we thought it would go. I really do. I think when you really get down to it, you're going to have some people fundamentally out there. And I want to say probably the younger generation. I'll get in trouble now. This is probably me going off cuff here a little bit. But I'm going to say, people 65 years and older probably going to have a little different view of this than somebody 30 years old that's going to have. I think they're going to be much more incentivized to go get that vaccine. Where I see somebody 30 years old, whether you live in rural Missouri or not, you may be going to just, hey, well, I'm just going to wait till there's no line someday and I'm going to go in there and get a vaccine. I don't know the urgency is there in that. But I think the people in rural Missouri, same thing. If you're in those age brackets, I think you're going to go out there and you're going to get a vaccine. I think we're seeing that. I just think it's this next levels we're going to get to that I think are going to be, for example, when the teachers do, it's going to be a much organized group you're doing. They're going to be much more organized to give that vaccine to when we're doing all these events in Kansas City or St. Louis. You're going to bring in large numbers of teachers, and they're going to be very organized to do that, where senior population is just strung out in a lot of different areas. So that's why I think we're going to be able to really increase the timing on this. But I don't think there's going to be any much difference at the end of the day. We'll see, so I don't want to speculate, but at some point we'll get to see, okay, what did rural Missouri do? What did urban Missouri do? But I'm going to tell you for me, it's about what will Missouri do. It's not about divisions in this state. It's about the state is unique, it's diverse because we are one state. And we have been that through time to come through good and bad. And I think it's important for us all to remember this. This is not a battle between any parts of the state. This is about us all being Missourians, doing the right thing, and respecting one another where each one of us live. Thank you very much. Thank you.